Hello, my name is Mary, and for the past few weeks I have been doing some research on cystic fibrosis, so today I will be doing a short presentation about the disease. So, an overview, cystic fibrosis is a progressive disease, so it's eventually a terminal illness. It is an autosomal recessive disorder, which I will discuss more in detail a little bit later, but basically that just means it's a genetic disorder with a particular inheritance pattern. It's diagnosed as an infant or in childhood, usually, diagnosed shortly after birth, and is a lifelong chronic illness. About 1 in 2,500 to 3,500 newborns in the U.S. are diagnosed every year. So it's actually a pretty frequent disorder plaguing white Americans. It requires a lot of medical attention. People who have relatives who have CF or friends that have CF, they spend a lot of time in the hospital due to flare-ups. People with CF have periods where their symptoms are worse and periods where their symptoms are better, and that sort of fluctuates throughout their life. And there is no cure currently. A little bit of history about cystic fibrosis. The first references that allude to sweaty skin and an early death, it was sort of a mysterious disease for a long time. Upon autopsy of these children and examination of different organs, such as the pancreas, it was found that the children who were dying young of this mysterious disease were dying of malnutrition. So then in 1938, it was named cystic fibrosis of the pancreas. And then throughout the 40s, 50s, and 60s, sweat testing is used to confirm the disease. And since a lot of medical advances have been made, such as the discovery in 1989 of the CFTR gene that causes cystic fibrosis, children are living a lot longer than they used to be, and so the survival rate is actually getting better every year. So let's talk about the CFTR gene. It's found on chromosome number 7. It stands for Cystic Fibrosis Transmembrane Conductance Regulator. So a normally functioning CFTR gene, the non-mutated gene, allows, or the protein allows for the flow of chloride in and out of the cell surface, and so it balances that fluid. So what goes wrong? Here you can see a picture of a healthy lumen and cystic fibrosis. So basically what happens in the mutated CFTR gene is that the channels that allow that fluid movement throughout the cell are either made incorrectly or not made. And so that fluid is put out of balance, and that is what causes the accumulation of mucus. So the types of mutations, there are 5 classes. Class 1, where no functional CFTR protein is created, is the second leading cause, or the mutation that causes most cases, the second most cases of cystic fibrosis. And the class 1 includes nonsense mutations, splice mutations, and deletions. Class 2, the protein is made but the structure is wrong. That is the leading cause of cases of cystic fibrosis. And an example of that is the deletion of 3 base pairs at location 508 on that chromosome. Class 3, the CFTR protein is made correctly, but then the channel gate does not open properly. These are also called gating mutations. Class 4, the protein is made correctly, but the gate just doesn't function properly, so it's faulty. And then class 5, the protein is made correctly, but not in sufficient quantity, so you just don't have enough of it to balance that fluid, and so the mucus builds up. So, symptoms. Because it is a progressive disease, it generally gets worse over time, and like I said before, there are periods where these symptoms are sort of at bay and they're managed, and then there are periods that are very bad that end up in hospital stays. Like I said, that fluctuates a lot depending on different factors throughout your lifetime. The most sort of unique symptom of this disease is the salt in the sweat, and that is actually used to diagnose cystic fibrosis, but there's excessive chloride in the salt in the skin, and so the skin actually tastes sweaty. The second most known thing about cystic fibrosis is that they have really poor lung function because of that accumulation of the mucus in the airways. So that would include asthma and a lifelong cough, which leads to fatigue, weight loss, and that mucus production. Poor pancreatic function is associated with symptoms such as malnutrition, failure to gain weight and thrive, and constipation. And then one of the unique sort of things to help people with CF is they go through periods of clapping where you actually tap their back forcefully in an attempt to dislodge some of that mucus and relieve some of the pressure in their airways to help them breathe a little better. Life expectancy. Early diagnosis is related to an elongated life. So whereas it used to be an exclusively pediatric disease, in the 50s, 60s, the life expectancy was 6 years of age, but now that medical advances have been made and there are newborn screening tests that can be done, early diagnosis is allowing for people to live 37.5 years in 2006, and babies born in 2020 can be expected to live into their mid-40s. So now we have adults living with cystic fibrosis, whereas it used to be an exclusively pediatric disease. And the better managed the disease is throughout the patient's life, the healthier the patient will be and the longer they will live. So let's talk a little bit about how it is a genetic disease. So it's autosomal recessive, as I said earlier. This means that both copies of the mutated gene need to be inherited in order for someone to have cystic fibrosis. So it doesn't arise spontaneously. It is that the mother was a carrier or had the disease, and the father was a carrier or had the disease. And so you inherit that from your parents. So I'm going to go through a simple pedigree, just a few things. Squares mean males and the circles mean females. Those pink dots mean that the person in the family did have cystic fibrosis, and that slash, as you can see in Matthew up top, is a person who has deceased. And you can see that he had cystic fibrosis, and Matthew died at the age of 49 from cystic fibrosis. So let's see. So Matthew had children with Jane, who was not a carrier and did not have cystic fibrosis. So then all of their children, Mackenzie, Colin, and Julia, all ended up being carriers. And then Colin, who was a carrier, married Alexa, who was a carrier. And so they have a high chance of having children with cystic fibrosis. And you can see Stella and Lauren were diagnosed with cystic fibrosis. So let's talk about the probability of having an afflicted child. So if both parents have cystic fibrosis, the children have a 100% of having cystic fibrosis because all of their genotypes will be homozygous recessive. If one parent has cystic fibrosis and the other neither has CF nor is a carrier of CF, all the kids will be carriers. If one parent has CF and the other is a CF carrier, half will be carriers and half will have cystic fibrosis. There's a 50% chance every time you get a child whether they will have the disease or be a carrier for the disease. And if neither parents are carriers, like I said before, it's a genetic disorder, the child has a 0% chance of having CF if their parents are nor carriers nor have the disease. The 5 feet apart rule is also a very unique sort of little tidbit about cystic fibrosis. Due to the weakened immune systems and chronic lung infections of CF patients, catching bugs that their bodies are not familiar to, catching viruses or infections, can be deadly to them. So especially catching bugs from other cystic fibrosis patients. So therefore they maintain the 5 feet apart rule where they refrain from coming within 5 feet of another CF patient. So that's definitely a huge part of their life, is not really being able to interact with other people in their community who are going through the same thing. So that's can be very isolating. And then talking a little bit about testing for cystic fibrosis. So a newborn screening is done via a blood drop of the heel of an infant, usually in the hospital when the mother and baby are still in the hospital. And then that's a relatively simple test. And if that comes back positive, usually what's done next is a sweat test where they do test the sweat of the skin of the infant and are looking for those high levels of chloride. And if that is inconclusive, because sometimes the sweat in the baby can be high in chloride due to a few other diseases, then genetic testing can be done. And also, carrier screening can be done in parents wishing to start a family, and that can indicate if parents are carriers and if they have any risk of having a child with cystic fibrosis. Here are my references, and I hope that you learned a little bit about cystic fibrosis, and I look forward to hearing about what everybody else researched for the past couple weeks. So, thank you.